What does 3D imaging reveal about arthritis joint anatomy? Imagine being able to see inside a joint like never before, with a clear picture of what's happening beneath the surface. That's exactly what three-dimensional imaging offers when it comes to arthritis. Unlike traditional two-dimensional X-rays, which give flat images, three-dimensional scans create detailed models of the joint structure. These models show the exact shape and size of bones, cartilage, and other tissues in 3 dimensions. This allows doctors to spot even tiny changes that might be missed on flat images. One of the main things three-dimensional imaging reveals is the space between the bones, called joint space width. As arthritis progresses, this space narrows because the cartilage that cushions the bones wears away. By measuring this space in 3 dimensions, clinicians can see how much cartilage has been lost. This is important because it helps determine how severe the arthritis is and how quickly it might be getting worse. Advanced techniques like joint space mapping use computed tomography scans to measure the joint space in 3 directions. This method produces color-coded maps showing areas where the space is wider or narrower. These visual tools make it easier for doctors to understand the health of the joint at a glance. They can see if certain parts of the joint are more affected than others, which helps in planning treatment. Three-dimensional imaging also overcomes some limits of flat X-rays. For example, overlapping bones or different joint positions can make it hard to get accurate measurements on two-dimensional images. With three-dimensional scans, measurements are consistent and reproducible, no matter how the joint is positioned. This consistency is key for tracking changes over time and seeing if treatments are working. High-resolution peripheral quantitative computed tomography is another form of three-dimensional imaging that provides very detailed pictures of small joints, like those in the hand. It can measure tiny changes in joint space width and volume, helping to evaluate damage in conditions like rheumatoid arthritis. In real-world use, three-dimensional imaging can screen people at risk of arthritis, such as athletes or those with previous joint injuries. It also allows for safer, repeated scans because the radiation dose is low. This means doctors can monitor the disease over time without worry. Overall, three-dimensional imaging paints a complete picture of joint anatomy affected by arthritis. It provides precise, measurable data that helps in diagnosing the disease early, predicting how it will progress, and planning the best treatment options. This technology is changing how we understand and manage arthritis, making it easier to see the full story inside each joint.